Before you swing your legs over the side of your bed tomorrow morning, I need you to stop, because what happens in those first few seconds could either protect you or put you in the emergency room. That is not an exaggeration, and that is not fear-mongering. That is simply the truth that too many seniors discover the hard way, and far too many families learn about only after it is already too late. We are talking about something that happens every single day, in homes across this country, in bedrooms that should be the safest places in the world. We are talking about morning falls, and we are talking about how one gentle, simple, almost effortless movement performed right there in your bed before your feet ever touch the floor can make an enormous difference in whether you start your day strong or whether you start your day on the ground. Now, I want you to really hear me on this. Falls are the leading cause of injury among adults over the age of 65. Not car accidents, not slippery sidewalks, not even staircases. The majority of serious falls among seniors happen right at home, and a significant portion of those happen within the first few minutes of waking up. And the reason for that is something most people have never been told, something that doctors rarely take the time to explain, something that gets glossed over in routine checkups and ignored in general health conversations. The reason morning falls are so common and so dangerous has everything to do with what your body goes through while you sleep, and what happens the moment you try to stand up too quickly without giving your body the chance to prepare. When you sleep, your body goes through a beautiful and necessary period of rest and restoration. Your blood pressure drops, your circulation slows down, your muscles relax completely, your nervous system shifts into a quiet mode. Your inner ear, which is responsible for your sense of balance, becomes temporarily less sharp. All of this is normal. All of this is healthy. Sleep is supposed to do these things. But here is the problem. When you wake up and immediately try to sit up, stand up, and start moving, your body has not had time to catch up. Your blood pressure, which dropped while you were sleeping, has not yet risen back to the level it needs to be for you to stand safely. Your muscles, which were completely relaxed, have not yet been reminded of what they need to do. Your balance system has not yet been reactivated. And the result of all of this is a dangerous few minutes of vulnerability that most seniors walk right into without ever knowing it. This condition, where your blood pressure drops suddenly when you stand up, is called orthostatic hypotension. It is incredibly common in older adults, and it is one of the primary reasons why so many falls happen right at the moment of getting out of bed. You might have experienced it yourself. That sudden dizziness, that rush of lightheadedness, that feeling like the room shifted for just a moment. Some people describe it as a brief blackout. Some people say they just feel suddenly weak. Whatever it feels like, it is your body telling you that it was not ready. And unfortunately, in that split second of unreadiness, a fall can happen. And for seniors, falls are not just bruises and embarrassment. Falls can mean broken hips, fractured wrists, head injuries, and the long, painful road of recovery that follows, not to mention the loss of independence and confidence that often comes with it. But here is what I want you to hold on to right now. This does not have to be your story. This does not have to be inevitable. Because there is a movement, a gentle, simple, absolutely doable movement that you can do right there in your bed before you ever attempt to get up, and it changes everything. It wakes your body up properly. It gets your blood flowing again. It reminds your muscles what they are supposed to do. It gently reactivates your balance system. It gives your cardiovascular system the time and the stimulus it needs to bring your blood pressure back up to a safe level before you ever put weight on your feet. And the beautiful thing is that this movement asks nothing extraordinary of you. You do not need to be fit. You do not need equipment. You do not need a gym membership or a personal trainer. You just need to be willing to spend a few extra minutes in bed doing something that could genuinely save your life. Let me walk you through exactly what this movement involves, because understanding it deeply is what will help you actually commit to doing it every single morning. The movement begins before you even open your eyes, before you do anything else. The very first thing you should do when you wake up is take 3 slow, deep breaths. Not rushed breathing, not your normal breathing. Intentional, slow, deep breaths that fill your lungs completely. Breathe in through your nose for a count of 4. Hold for a count of 2. Breathe out through your mouth for a count of 6. Do this 3 times. This simple act does something remarkable. It begins to gently stimulate your cardiovascular system. It tells your nervous system that it is time to wake up. It starts the process of transitioning your body from sleep mode to waking mode in a calm and controlled way. Think of it as the very first signal you send to your body that the day is beginning. After those 3 deep breaths, while you are still lying flat on your back, you are going to begin what is called ankle pumping. This is the heart of this entire morning routine, and it is so simple that it almost seems too easy to matter. But do not let the simplicity fool you. Ankle pumping is one of the most powerfully effective tools we have for combating the exact physiological conditions that lead to morning falls. Here is how it works. Lying flat on your back, you simply flex your feet up toward your face, pulling your toes up as high as they will comfortably go. Then you point your feet down, away from your body, extending your toes toward the foot of the bed. Up and down. Up and down. You do this slowly and rhythmically, about 10 to 15 repetitions. That is it. That is the movement. But let me tell you what is happening inside your body while you do this. Your calf muscles, the large and powerful muscles in the back of your lower legs, act as a kind of secondary pump for your circulatory system. When these muscles contract and release, they squeeze the blood vessels in your legs and push blood upward, back toward your heart and your brain. When you have been lying still all night, blood naturally pools in your lower extremities. Your legs essentially become reservoirs of blood that your brain and your cardiovascular system cannot fully access, and when you stand up suddenly, your heart has to work incredibly hard to overcome gravity and redistribute that pooled blood upward. If your heart cannot do it fast enough, your blood pressure drops, and you get dizzy, you lose your balance, and you fall. Ankle pumping solves this problem by activating those calf muscles before you stand. It essentially empties the reservoirs in your legs, and gets that blood moving again while you are still safely lying down. By the time you actually stand up, your body has already done the work of redistributing your circulation. Your blood pressure is already rising. Your system is already primed. The transition from lying down to standing becomes smooth and safe instead of sudden and dangerous. After your ankle pumping, while you are still lying on your back, you are going to add a few knee lifts. One at a time, you bring your knee up toward your chest as far as is comfortable, hold it there for a count of 2, then lower it back down. Do 5 repetitions with each leg. This movement serves a different but equally important purpose. It reactivates the large muscle groups of your hips and thighs, the muscles that are actually going to bear your weight when you stand. It gently stretches the hip flexors, which tend to tighten overnight, and it begins to wake up the muscle memory and neuromuscular pathways that your body needs for stable, controlled movement. It also continues to promote circulation and begins to bring gentle warmth into your joints, which is particularly important for seniors who deal with arthritis or joint stiffness in the morning. Now, after your knee lifts, you are going to move into the next phase, which is the sitting transition. This is where most people rush, and it is where most morning falls actually begin to happen. After you have completed your ankle pumping and your knee lifts, you are going to slowly roll to your side. Do not try to sit straight up from a flat position on your back. That motion puts enormous strain on your abdominal muscles and your back, and it also triggers a rapid shift in your center of gravity that your balance system may not be ready to handle. Instead, roll to your side first. Use your arms to push yourself up gently as you swing your legs over the side of the bed. Sit on the edge of the bed and stop. Do not stand up yet. This is what is called the seated pause, and it is absolutely critical. Sit on the edge of your bed for a full minute, at least 60 seconds. During this time, you are going to do one more round of ankle pumping, just 10 repetitions. You are going to take a few more deep breaths. You are going to look around the room, give your eyes a moment to adjust. Give your vision a moment to sharpen and focus. You are going to feel your feet flat on the floor and notice how they feel. You are going to pay attention to your head. Is it clear? Do you feel any dizziness? Any lightheadedness? If you do, do not stand. Sit there longer. Let it pass completely before you try to stand. This seated pause is not just about physical preparation. It is also about mental and sensory preparation. Your inner ear, your vestibular system, needs a moment to recalibrate after you change positions. Your vision needs to adjust. Your proprioception, your body's sense of where it is in space, needs to come fully online. All of these systems were in a restful state during sleep, and they need just a little time to wake up properly. That 60-second seated pause gives them that time. When you are ready to stand, you are going to place both hands on your thighs or on the edge of the bed beside you. You are going to lean forward slightly, shifting your weight over your feet, and then you are going to push up to standing in a slow, controlled way. Once you are standing, do not immediately walk away. Stand there for a moment with your hands resting on a stable surface, whether that is the bed, a bedside table, or a nightstand. Take another breath. Check in with how you feel. Make sure you are stable, clear-headed, and balanced before you take your first step. That is the complete movement sequence. Deep breathing, ankle pumping, knee lifts, side roll, sitting position, seated ankle pumping and pause, and controlled standing. From start to finish, this entire sequence takes about 3 to 5 minutes. 3 to 5 minutes that could be the most important. 3 to 5 minutes of your day. 3 to 5 minutes that could be the difference between a normal morning and a catastrophic one. Now, I want to address something that I know some of you might be thinking. You might be thinking that this sounds like a lot. You might be thinking that you have been getting out of bed for 70 or 80 years without doing any of this, and you have been fine. And I understand that thought completely. But I want to gently remind you that our bodies change. The body you have at 65 or 70 or 80 is not the same body you had at 40. Your cardiovascular system does not respond as quickly as it once did. Your muscles do not maintain their tone as easily. Your balance system is not as sharp. Your bones are not as forgiving if you do fall. These are not weaknesses or failures. They are simply the natural realities of aging. And the smart, empowered response to those realities is not to ignore them. It is to adapt. It is to give your body what it needs. I also want to say this clearly. Doing this movement sequence every morning is not about living in fear. It is not about treating yourself as fragile or incapable. It is actually the opposite. It is about being proactive. It is about taking control of your health in a way that most people never think to do. The seniors who practice this routine are not the ones who live in fear of falling. They are the ones who get up every morning with confidence, with stability, with energy, because they know that they have given their body what it needs to function at its best right from the very start of the day, and the benefits go beyond just preventing falls. When you begin your day with intentional breathing and gentle movement, you are also stimulating your lymphatic system, which supports your immune function. You are gently stretching your muscles and joints, which reduces the stiffness and pain that many seniors experience in the morning. You are increasing blood flow to your brain, which supports mental clarity and alertness. You are setting a calm, intentional tone for your entire day. People who practice morning routines like this consistently report that they feel more awake, more alert, and more energized throughout the morning than they did before they started. It is a small investment that pays enormous dividends. Let me also speak to the family members and caregivers who might be watching this. If you love someone who is a senior, if you have a parent or grandparent or spouse who you worry about in the mornings, please share this with them. Not in a way that frightens them or makes them feel like they are in danger, but in a way that empowers them. Show them this movement sequence. Practice it with them. Make it a conversation. Ask them how they feel in the mornings. Ask them if they have ever felt dizzy when they first get up. Create an environment where they feel safe talking about these things, because so many seniors hide their morning dizziness or their near falls out of fear that admitting it will mean losing their independence. Help them understand that taking these preventive steps is exactly what independence looks like. It is not weakness. It is wisdom. If you are a senior watching this, I want to leave you with this thought. You have spent your entire life building something. A home, a family, a set of experiences and memories and relationships that are irreplaceable. You have worked hard, you have persevered through challenges, and you have earned this chapter of your life. Do not let a preventable fall take any of that away from you. You deserve to move through your days with confidence and safety. You deserve to wake up every morning and step into your day with strength. And that strength begins with something as gentle and simple as moving your feet up and down before you ever get out of bed. Start tomorrow morning. When your alarm goes off, or when your eyes open naturally, before you reach for your phone, before you check the clock, before you think about what you have to do that day, take those 3 deep breaths. Start pumping those ankles. Give your body the gentle, loving wake-up call that it deserves. Make it a habit. Make it as automatic as brushing your teeth. Because once it becomes part of your morning rhythm, you will not be able to imagine starting your day without it. And that is exactly where you want to be. Your body has carried you through decades of life. It has taken you places, raised your children, held the people you love, done extraordinary things that you may have taken for granted. Give it 3 to 5 minutes every morning. That is all it is asking for. And in return, it will carry you forward safely, steadily, and with the strength that you deserve. Take care of yourself. Start with this gentle movement, and make every single morning a safe one. Thank you for watching Dr. Mark Official. I'm Dr. Mark, and I hope this helped you take one more step toward better health and balance. Stay safe, stay active, and I'll see you in the next video.